Okay, welcome back to part 4 and the final part of this product demonstration for the DSD-8127 11 drug plus alcohol saliva drug test. This test now run for exactly 10 minutes from initiating the saliva into the barrel, and we're now going to run you through interpretation of the results. So if I just tip the test slightly towards you, I hope you can see that on camera. If I rotate it round, you will see initially, if we have a look at the alcohol test membrane pad, there's been no colour change there, indicating zero alcohol has been detected in this saliva sample. If we then run you round the 11 drug tests, you're looking for the presence of a control line, which is the top line forming nearest the top of the test, and you're looking for 11 of those to have formed. So if I rotate round, you can see nicely that we have all 11 control lines showing beautifully. And now for interpretation of your results, you're looking for the presence or absence of a test line. No matter how thin or how faint, if there is a line there showing at 10 minutes, you have a negative result. So 2 lovely strong lines for the buprenorphine indicating a negative result, same for barbiturates, same for methamphetamine, same for OPI. The cocaine membrane, you'll see, the test result is thin and faint, but it's still there, it's a negative result, same for amphetamine, oxycodone, benzodiazepines, methadone, cannabis. PCP has a very faint test line there, but again a discernible line. That's perhaps the thinnest and faintest on this, but one must remember that the nature of these tests is that they are screening at completely different nanogram levels for drug detection, and depending on the sample that's put in there, you will see some variance from test to test, and certainly from membrane to membrane. That is perfectly normal. It's the presence of any test line discernible at the read time that indicates the presence of a negative result. And that is a negative result, even though it is very faint for PCP. So there you have it, a clear all-round negative test result for 11 drugs plus alcohol. If these control lines and test lines show earlier than the 10-minute read time, you can interpret your results at that phase. The guidance where you've got the alcohol test also included in one of these barrel tests is to give it the full 10 minutes development before you read your result and interpret it. Okay, so a test using this will take between 10 and 15 minutes to complete for each individual that you're screening. There is space on these barrels for you to label, identify the donor and the date. So if you are running a sequence of 10 or 15 tests, you can run a procedure where you are sampling from an individual, asking them to leave the room, sampling from the following individual, and then transferring them back for the results. We feel, in terms of the chain of custody and impact, it is better to run a procedure where you are running the test in front of the individual that you're taking the sample from, and that they are waiting with you while you wait for the interpretation of the results and running through it with them. There are simple procedure forms that we can supply by email for you to edit to the various drug groups that you've chosen to put on the tests that you've purchased, that you are then able to keep as a documented record of the result. These can be witnessed by 2 people, or the sampler and the donor verifying the result has been accepted. So that is the DSD-8127 product demonstrated for you. These are available from the UK Drug Testing and Drug Testing Kit websites. We do break the packs down where they are not required in multiples of 20, but to really get the benefit of the full data sheet and the cross-reactivities, then a carton of 20 is the ideal pack size to be buying these in. Thank you.